Hey everyone, welcome back to the Mass Retirees Weekly Update. Today's Friday, March 1st. I'm Sean Duhamel. Thank you so much for joining with us and tuning in again this week. Now, this has been a week all about healthcare here in Boston on Beacon Hill, starting with the hearing that we had this past Tuesday on the creation of a new special commission on retiree healthcare. And then just yesterday morning, the State's Group Insurance Commission met to vote on the FY25 health insurance premiums, as well as the dental insurance premiums. So let me start with the GIC, and then we'll backtrack into the legislative hearing that took place on Tuesday. So as we have been reporting over the past few months, the GIC has been engaged in its normal beginning of the fiscal year, or transitioning into the new fiscal year, plan design, rate setting process. To start off, all of the health insurance plans that are currently offered through the GIC, as well as the dental and vision benefits, will be offered again for FY25, which starts on July 1st. Nothing is changing. If you are happy with your current insurance coverage, there's nothing you need to do. Open enrollment takes place during the month of April. You don't need to do a thing. Just sit tight. You'll stay in the same plan that you're on now. However, if you do want to make some changes, open enrollment is the time to do that. And we'll be reporting on open enrollment through the GIC as that April deadline draws a little bit closer. But for now, let's focus on the action that the GIC has taken over the past few months. Now, back in January, the GIC voted and met and decided that they would hold the line on the current plan design. And what we mean by plan design is primarily co-payments, deductibles, the tiering, networks, things like that. There are no changes to speak of when it comes to any of those sorts of things, particularly when it comes to out-of-pocket costs. Co-payments and deductibles are the out-of-pocket costs that you hear us refer to. And I'm happy to report, and we've been reporting on this now for the last couple of months, the GIC has not increased co-payments or the annual deductible for 7 years running. This July 1st will mark the 7th consecutive fiscal year where we've had stability and continuity when it comes to out-of-pocket costs. And this is a really good thing. The worst case scenario always with health insurance plans is that out-of-pocket costs continue to rise, which is fine if you are healthy or you're lucky enough not to get hurt or sick or have any kind of problem that requires you to utilize your insurance. But if you're someone that does have to utilize your insurance, having high out-of-pocket costs can be financially devastating, and we hear that from members all the time. The number one complaint we get about the GIC plans or any of the local plans is never based on the quality of the insurance. It's always talking about the cost, sometimes about formularies and access to physicians outside of Massachusetts, but primarily the complaints or concerns that we hear from members most about are relative to out-of-pocket costs. So again, we're very thankful that the GIC decided to hold the line once again when it comes to increasing out-of-pocket costs. And holding the line is consistent with the public position that the GIC has taken in recent years, and also the public position taken by the Healthcare Policy Commission, which we have reported on over the past several months. The HPC, which is a state agency that oversees and regulates and studies the healthcare marketplace here in Massachusetts, has continually found that the higher you make out-of-pocket costs, the less likely are individuals to seek needed medical care. And the longer you put off needed medical care, not only is it going to have a negative impact on your quality of life down the road, but it also most often leads to higher medical costs down the road. Something that is a simple problem today, if it goes unaddressed, it can be a very significant, very expensive problem tomorrow. So the HPC, for the last several years, has also been recommending to the GIC when they meet in November to be very cautious in terms of increasing out-of-pocket costs on enrollees and in particular on retirees. So why this is significant this year in particular is important. We all know that the cost of virtually everything has gone up in recent years. We're now seeing the cost of healthcare once again starting to dramatically increase. And there are various reasons for that, and we talk about it in today's email blast, and we've talked about it in the newsletter, and I'm going to talk about it a little bit right now. But beyond the normal cost of inflation, which again, all of us have personally experienced over the last 3 years or so, really since the pandemic and up until recently, costs of a lot of items have been pretty high. Healthcare is no different. But what also has really been exacerbating the medical inflation, or causing medical inflation to rise, is the continued rapid price increases when it comes to prescription drugs. Now, as the GIC reported yesterday, for the coming fiscal year, the new series of weight loss medications, and this is just one example, but the new weight loss medications, which the GIC does cover, has added $60 million to the GIC's budget for FY25. That $60 million represents 7% of the overall pharmaceutical spend by the GIC, which is pretty significant when you consider all the drugs that they are paying for, that 7% are specifically linked to these brand new weight loss drugs. And as we talk about in today's email message, it is a good thing that the GIC is covering these types of life-altering and life-saving, in some cases, medications. We don't ever want to see a situation where the GIC or our local health insurance plans, for that matter, are simply saying, no, we're not going to cover this innovative new drug or this innovative new procedure because it's too expensive. But at the same time, we need to be mindful that these new innovative medications and techniques and tests and machinery, it all comes with a very high cost, and everything is interrelated. So this has kind of been a long-winded, roundabout way to get to the action the GIC took yesterday. The GIC, we expected this, we knew it was coming, we've been reporting on it, but the GIC voted to increase monthly insurance premium costs for the coming fiscal year. Now, there's good news and bad news here. The bad news is that the costs are going up across the board, which we never want to see, regardless of the reasons why. At the end of the day, retirees and the active employees who are insured through the GIC are left having to pay the bill. The good news is that these higher costs are largely being absorbed by the Commonwealth or by the cities and towns that participate in the GIC, because the increased costs have been spread out amongst the insurance premiums rather than out-of-pocket costs. So the GIC wisely chose not to cost shift onto the backs of the enrollees. So for the non-Medicare plans, the average increase in monthly cost is going up by 9.5%, 9.5% year over year. The news does get better on the Medicare side, and the majority of our members are insured through Medicare. The average Medicare cost is going up 4.1% for the coming fiscal year, which brings me to a very important point. The evidence is clear that the cost of non-Medicare health plans continues to sharply rise year over year. This is why we need to find a path forward in working with the GIC to implement what we refer to as the Medicare buy-in program. And you have heard us talk about this time and time again. Those of you who are insured through the GIC, who are age 65 or older, who are not eligible for Medicare and therefore are enrolled in the non-Medicare plans, forced to pay higher monthly premiums, forced to pay higher out-of-pocket costs associated with the non-Medicare plans. I know you've been following this issue very closely. And the decision by the GIC yesterday, while we understand the reasons why they had to take this action, and really their hands are tied in terms of choices, it makes it all that much more important, again, to find a way forward in 2024 to finally transition the 10,000 or so non-Medicare retirees into the Medicare plan. And we'll continue to work closely with the GIC staff as well as the Healy administration to find a path forward with that, and we will be reporting back to you in the coming weeks and months in terms of any kind of progress that we're making on that. But it is a very, very important topic that really needs to be addressed. So in terms of the other votes the GIC took. They also took a vote on the retiree pay-all dental plan, which is run through MetLife. This plan was created back in 2002 at the request of our association. Back then, there was no retiree dental plan at all. One of the conditions that the state put in place in terms of implementing a retiree plan was that it be retiree pay-all. And what I mean by that is that the state or the Commonwealth does not contribute anything toward the retiree dental plan other than helping to facilitate it as part of a group plan through the GIC, which naturally keeps the costs down. The Commonwealth is not subsidizing the plan at all. So year over year, it is always a struggle to try to balance keeping the dental benefits affordable for retirees while at the same time doing the best that we can and the best that GIC can to offer a meaningful set of benefits. So the good news is that the dental insurance premiums remain unchanged from the current FY24 going into FY25. There are no changes in the monthly premium. That is very good news. And I believe that there's another year or two on the MetLife dental contract, so it's something that we'll be keeping a close eye on going forward. I know that we're hearing from a growing number of members expressing concern about the dentists that are available in the network. We know that not only here in Massachusetts, but around the country, fewer and fewer dentists are accepting any type of dental insurance. The reason for that is dental insurance isn't really insurance. It's more of a discount program, if you will. It does not operate on the same manner or in the same manner as health insurance. It never has, which that presents some unique challenges as well. But the good news is that the costs are not going up. Now, I'm sure a lot of you watching this video who are insured through the GIC are wondering, well, what does this mean in terms of my specific monthly premium? We do not have the breakdown just yet of exactly what members will be paying. The GIC will be sending all of you who are enrollees your benefit decision guide toward the end of March. You will have that prior to open enrollment starting the first week of April. Our association will also publish in our May newsletter the full rate chart. Once again, it's always a center spread in the May newsletter that breaks down specifically what your monthly costs will be, including the basic life insurance premium. So all of that will be included in the May newsletter, which you will receive in early April. And it'll give you ample time to review all of that material and then make a decision on whether or not you want to switch insurance coverages. As I said at the outset, if you are happy with your current coverage, you don't need to do anything. Nothing whatsoever. You just stay in the plan you are in now. There's nothing you need to fill out, check off, nothing. Just sit tight, do nothing. But if you do want to make a change, open enrollment is the time for you to do that. Now, I want to go back to the hearing that took place earlier this week on Tuesday. The Joint Committee on Municipal and Regional Governments met. The committee is chaired by State Senator Jake Oliveira from Ludlow and State Representative Carol Fiola from Fall River. They are very good friends of our association, staunch defenders and allies of public retirees. I want to thank them for their thoughtful questions and the interaction that we had on Tuesday. The hearing was specifically related to a piece of legislation filed by Governor Healy that contains a lot of municipal reforms. Part of those municipal reforms is the creation of a special commission on public retiree health care. And I talked a little bit about this last week in the video and talked about it in the accompanying email. This special commission is modeled after a commission that existed in 2012, which our association was part of. And as a matter of fact, I was the association's designee to the special commission. And that's why when I testified on Tuesday, I said, this is deja vu all over again. Because 12 years went by awful quick, and here we are right back working on the exact same topic all over again. Now, what has us concerned is that we believe the driving force behind the creation of this commission is not necessarily to do something good for future retirees. The folks who I think are pushing this, and this is not a criticism of the governor, because we are very thankful that she has once again chosen to give retirees a seat at the table and to ensure that you have a voice in this process. So that is very important. But folks out there at the municipal level and from some of the nonprofit government budget watchdog groups for years have been focused on trying to reduce the cost of retiree health care, and at the same time, in reducing those costs, potentially cost shifting onto the backs of future retirees and or degrading or lessening the quality of the insurance benefits all of you are receiving. And it goes without saying, we are dead set against any changes of that magnitude or that would focus on those things. As I said at the hearing on Tuesday, our association is all for finding ways to gain control over future healthcare costs, not just for the government or for the taxpayers, but for our members as well. Because as we were just talking about, you are being forced to pay a larger and larger portion of these costs, and all of you are living on fixed incomes. So something has to hit the breaking point, but that something should not be putting more burden on your backs or the government walking away from its responsibility to provide high quality, affordable health care benefits to its retired workforce. So we are going to continue to work with the GIC and Blue Cross and Blue Shield, in Maya, in Unicare, and any other healthcare entity that wants to partner and work with us to find innovative ways to serve our members, to help you lead higher quality, healthy lives while gaining control over these future costs, which are going up for everybody. But we're not going to sit back and allow anyone to attack our members or to degrade the future quality of retiree health insurance benefits. So we are looking forward to working with the legislature, looking forward to working with the Healy administration to find a way to address these higher costs across the board, while at the same time protecting these extremely important and valuable, critical benefits for all of our members. Last thing before I sign off today, just a reminder for those of you who are either living in Florida or have escaped the Northeast this time of year and are going to be down in Florida next week. This coming week, we have 3 meetings in Florida. Starting on Wednesday, March 6th, we will be in Estero, which is just north of Naples. On Thursday, March 7th, we will be in Largo, Florida. And then finally, on Friday, March 8th, for the first time ever, we will be in the greater Orlando, the Villages area, with an area meeting in Lady Lake, Florida. All of the information on the specific locations is contained in the newsletter on page 4. It's also in last week's email blast. It's up on the Mass Retirees website at massretirees.com. If you are in and around the Gulf Coast of Florida or the greater Orlando area next week, come on by and say hello. We are really hoping for robust crowds at these meetings. It's now been 4 years since we have traveled to these locations in Florida. We're looking forward to seeing our members who live in and around that area once again. And as I said, come by and say hello. All of the meetings start at 11 a.m. We're going to be tired by the end of the week. This is definitely going to be one of these sort of whistle-stop tours, if you will, but we're looking forward to seeing everybody once again. Be well, everyone, and we'll talk to you again next week. Bye-bye.